Exposing mental health continues to be a talk across the country, especially with gun violence and the opioid epidemic. Today is the beginning of Mental Illness Awareness Week. In fact, 1 in 5 Americans will experience it this year. Here to walk us through some of the facts is Dr. Bankole Johnson, the Chief Medical Officer for Adial Pharmaceuticals. Doctor, what is the mental illness definition, first off?
Well, mental illness, thank you for having me on your show. Mental illness is actually a complex thing to define, but I'll try. It's a disorder in which there's an aberration of thinking, behaving, or actually doing something that is associated with troubles in your perception, or troubles in your behavior, or difficulty in your emotions. For example, depression.
Is that the most common, depression?
Yes, depression is one of the most common psychological problems.
Mm-hmm.
Yes.
And how do you recognize the symptoms of mental illness or depression?
Well, usually most people talk about seeing a change in the behavior of a person. Depression is typically very easy. The person tends to be gloomy all the time. They may be tearful. They may want to sleep all day. They may not be eating properly. So depression is fairly easy to recognize even for a lay person. There are other types of mental illness that are far more complex to identify for somebody who's not trained.
Yeah, let's talk about your specialty, which is addiction. What's the difference between addiction and mental illness?
Well, addiction is, if you like, the habitual use of a compound or a chemical that is associated with psychological consequences. Those psychological consequences can be loss of a job, loss of a marriage, difficulty in focusing, a lot of consequences. Violence sometimes, or aggression.
Are those symptoms harder to spot than depression?
They're harder because until the addiction becomes very serious, most people are able to conceal the addiction, especially addiction to alcohol.
Okay. And what about the things that family members can do if they suspect a loved one is suffering from mental illness or addiction?
The most important thing to do is to go to your family practitioner, your family doctor. Your family doctor should be able to take an accurate history and to be able to recommend various types of treatment. Unfortunately, in the United States, we haven't done very well in training our family practitioners to understanding how to diagnose and provide treatments for addiction, but that's been improving.
Okay, and moving forward, how do we get over the stigma with mental illness, and what trends do you see that are helping improve the treatment of those with mental illness?
You know, that's a fascinating question, and actually, I wish I could give you a really good answer to it. You know, but talking about it certainly helps. And in South Florida, as you know, we have a cultural society that we're very interested in our physical well-being. But most people don't wake up in the morning and say to themselves, rather than saying, I'd like to go for a run, they don't say, well, I'd like to take my brain for a run, or I'd like to make my mental health better today. But that's really something we all should try and be thinking of. What are the positive things we can do in our lives to make our mental health better?
All right, mental health is important. Thank you so much for stopping by.
Thank you so much.
Dr. Johnson, everyone.